Is Belize's tap water safe to drink? That's the question stirring debate after the Statistical Institute of Belize revealed that many of the 5,000 households surveyed in the latest multiple indicator cluster survey tested positive for E. coli. For some, that sounded like a failure in the national water system. But today, SIB set the record straight. Director General Diana Castillo-Trejo explained the tests weren't done on the national water supply, but inside homes, using various water sources. In other words, contamination happens after the water reaches your tap.
We emphasize that the mixed results did not seek to measure the presence of contaminants in our national water supply, but rather at the point of consumption in the home, regardless of where the household obtains its drinking water. The highest proportion of at-risk households, for example, was among persons whose drinking water is obtained from rainwater collection. This indicates a need for improved catchment and first flush diversion systems for these households. Furthermore, the gap between the results for the source versus the household samples highlights the importance of addressing household water storage and hygiene practices.
About 5,000 households were tested, urban and rural, and the results tell an important story. Most of the contaminated water came from rainwater collection systems, pointing to a need for better hygiene practices at home. Chief of Operations at Belize Water Services, Sanjay Keshwani, reassured the public that BWS runs daily water tests using 7 different procedures to keep the national supply safe.
At every step, we make sure that water is being processed for a potable reason or for drinking purpose. And I would like to ensure or mention that we follow minimum WHO standard, but we aim for AWWA and ISO standards, which are more stricter than WHO standards. Now, one more clarification is that at no point of time the survey was done at BWS plant as source. It was done at the household level, and at their source means maybe they have the tank, or maybe their tap, or their receptacle, or their water coolers, example. So it has nothing to do with BWS.
While the contamination may not begin at BWS, the report draws attention to the serious issue of water collection and storage methods across Belize. Testers for Mix 7 underwent 6 days of training with a kit designed specifically for the Mix 7 reports, analyzing 100 milliliter samples from multiple sources. Trejo reveals the alarming number of households flagged in the report.
At the source level, where households first access their drinking water, such as the tap, dispenser, or water tank, results showed that there was no detectable risk of contamination to the drinking water of 70.2% of the population. 14% fell within the moderate risk range, while 9.8% were at high risk and 5.9% were at very high risk. With respect to drinking water at the household level, collected from a drinking receptacle, 66.3% were not at risk, while 15.3% were in the moderate risk range, 10.6% at high risk, and 7.8% at very high risk.
The Ministry of Health and Wellness also provided insight into the rigorous water quality testing that the national supply undergoes, highlighting that it meets the World Health Organization standards for potable water.
All our results that we receive in the laboratory are always screened and compared to the World Health Organization guidelines. And once we see a red flag, we act expeditiously to remedy the situation or to give directives and recommendations for corrective actions of whatever system has been flagged as being at risk.
The Mix 7 report was created to provide stakeholders with crucial data needed to address issues of national importance. Now the ministry is advising that the public takes the necessary steps to reduce contamination of residential water supply, including using the flush first method for rainwater collection and frequent disinfecting of hands and water storage containers. Britney Gordon for News 5.